Thank you, Mr. Chairman. Mr. Sunstein, welcome back to our committee. We welcome you back. We're always glad to see you here. We welcome the changes that are coming from some of the agencies. I do still want to hear more about what the administration is doing and if they are doing anything to slow the continual onslaught of regulations that are being promulgated and implemented. Now, we went down to the White House earlier this week, a Republican conference on one day, the Democratic on another, and the president said to us that he wanted to clear out the regulatory underbrush. So I took that as a positive sign. He said the regulations should not be obscure. They should not be difficult for people to understand. What is hard to understand is how the administration wants to continue to be anti-employer and at the same time be pro-jobs. It just doesn't seem to be working out, as we saw from this morning's employment numbers. And businesses across the country are plagued with uncertainty as to what the new regulations will be and what will be handed down next by Washington. I understand the use of regulations to ensure safety and to promote the predictability of the market, but you must know that every day people come to Washington to tell their congressman or woman their fears about the avalanche of regulations that will increase their compliance costs. I hear from business owners talking about how regulations coming from HHS, EPA, bank examiners, and more, and unfortunately, I don't see how this review is actually going to be a deliverable that will help them through the problems that they are having. And I might add, those problems are delivered by the United States Congress. While some of the regulations may be necessary, I feel that many in Washington don't understand or comprehend the effect that the regulations have on jobs and job creation. It's a simple fact. When compliance costs go up, that cuts into a business's bottom line, and that means jobs are likely to be lost. I'm afraid this review has, for some purpose, perhaps just been for political purposes. I think that this was the reaction of a president who doesn't understand how to create jobs, so this is his attempt to appease business. After all the public relations and the rollout of the review, the higher-ups at the White House will have little interest in continuing the review, particularly after special interest groups and outside groups castigate the White House for reviewing the regulations in the first place. A specific area, the regulations that are coming out, like the medical loss ratio, rate review, and accountable care organizations, in all cases, the federal government has taken something that was working in practice and proving that it can't work in theory. Now, these pieces would ensure more consumer benefits, lower costs, and encourage care coordination where patients, doctors, and hospitals work together for patient improvement and financial savings. But because of the way that the regulations have been written, we'll still have systems that encourage fraud. Plan solvency will be at risk. There's the ultimate consumer protection. If your plan goes bankrupt, you don't get much health care delivered. And then accountable care organizations, that's the unicorn that turns out that not only nobody really believes it exists, nobody now wants to adopt it because it is just simply so difficult and so onerous. So I hope that you folks over at Office of Management of the Budget and your counterparts at the Federal Trade Commission will understand this and perhaps allow doctors in this country once again to practice medicine. I'll yield back the balance of my time, Mr.